Excellency Samdech Krolahom Sarkheng, Deputy Prime Minister and Minister of Interior of Cambodia, Excellency Mr. Tongchan Maniksai, Minister of Home Affairs of Lao PDR, Excellency Mr. Leota Lamositelelaki Sio, Minister of Women, Community and Development of Samoa, Excellency Ms. Saifa Mohamad, Deputy Minister of Health of Maldives, Excellency Mr. Pankar Anwarul Islam, Cabinet Secretary of Bangladesh, Excellencies, distinguished delegates, ladies and gentlemen, I'm delighted to welcome you all to this Ministerial Roundtable on Building Resilient CRVS System, incorporating lessons from COVID-19 in the second half of the Asia-Pacific CRVS Decade. The COVID-19 pandemic has affected the ability of governments to maintain services and routine functions, including the operation of National Civil Registration and Vital Statistics, or CRVS systems. The universal, compulsory, continuous, permanent, and confidential recording of the occurrence of all vital events is undermined by the various restrictions imposed by governments, such as quarantines, lockdowns, social and physical distancing measures, workplace closure, transit shutdowns, and many more. The resulting changes in civil registration systems are detrimental to the quantity and quality of civil registrations. Many CRVS systems have considered marriages and divorces to be less important vital events, and a number of countries have suspended recording them. While innovative approaches are mitigating the effect of COVID-19 on the performance of civil registration systems and are supporting the generation of data for health surveillance during a health crisis, this often disproportionately excludes developing countries with poorer connectivity and infrastructure. This Ministerial Roundtable will provide an opportunity to reflect on the challenges posed by the pandemic and potential solutions. Ministers will be able to share their experiences of maintaining services during this difficult period and inspire and guide efforts to enhance the functioning of CRVS systems during emergencies in the second half of the Asia-Pacific CRVS Decade. I'm delighted that we have such esteemed participation by ministers in this event, highlighting the importance accorded to CRVS. And I would like to thank our moderator, Ms. Harpinder Kolakot, Chief Executive Officer of Development Initiatives, for kindly agreeing to moderate this roundtable. Excellencies, distinguished delegates, I'm confident this event will share valuable approaches and good practices on improving CRVS systems to be more resilient for future crises and pandemics, and encourage innovative ways to achieve this. I look forward to the rich discussion today. Thank you very much.
Thank you very much, Madam Speaker and Executive Secretary. Welcome to the Ministerial Roundtable on Building Resilient CRVS Systems, incorporating the lessons from COVID-19 in the second half of the Asia-Pacific CRVS Decade. In this session, we will hear from esteemed ministers from whom we have invited 3 rounds of comments, followed by, if time permits, a brief discussion and then closing statements. We have an hour for our panel today, and we've got an incredibly highly esteemed panel, so I'm hoping we will have time to go through everything that we are intending to cover. My name is Harpinder Kolakot. I am the Chief Executive Officer of Development Initiatives, and I have the pleasure of chairing this panel with us today. Development Initiatives is an organisation that puts data-driven evidence in the hands of policymakers to support actions around ending poverty, reducing inequality and building resilience. We work with partners around the globe to build strong, resilient national and subnational data systems which will improve data on people and ensure that policymakers can make the right decisions at the right time. So let me start off today by briefly introducing our panel of ministers, and then I will invite our guests to present their remarks. I am told this session cannot overrun, so I will be asking our panel to respectfully stay within the time that they have been allocated. First of all, let me introduce our esteemed panel this morning. Firstly, we have Somdet Karilhom Sankher, of Deputy Prime Minister and Minister of Interior of Cambodia. Secondly, we have His Excellency Mr. Kandahar Anwar Islam, Cabinet Minister Secretary of Bangladesh. We also have with us His Excellency Mr. Tongchai Manieks, Minister of Home Affairs, Lao PDR. The Honourable Leotet Lemasitel Laki Sao, Minister of Samoa, Bureau of Statistics and Ministry of Women from Samoa. And the Honourable Ms. Safia Mohammed, Deputy Minister of Health from the Maldives. Welcome to you all this afternoon. But before we begin, I would like to take this opportunity to pass on my deepest condolences from all of us here today to the Minister from Samoa of the recent passing of Miss Melafone, who was the National Statistician and Civil Registrar General of Samoa. Your Excellency, please accept our deepest sympathies and convey them to Miss Melafone's family, friends and colleagues of the tragic loss that we have seen this weekend. Now, without further ado, let me move on to our first question. The first thing that I would like to ask all of our honourable guests today is to comment on how their countries have responded to the challenges posed by the pandemic to civil registration systems, and how they have ensured that those who are most marginalised and vulnerable in their populations have continued to access vital services in the face of disruption. I'm going to firstly turn to Somdet Karilhom from Cambodia to get us started. Thank you.
Thank you. Excellency, Ms. Amida Sazia Alicia Bana, Deputy Under Secretary General of the United Nations and the Executive Secretary of ESCAP. Excellencies, ladies and gentlemen, the COVID-19 pandemic has prolonged with great uncertainty due to the new surge of coronavirus mutation, which is more deadly and which continues to disturb socio-economic activities. And it has also the impact on the ability of Cambodia's government to maintain its services and routine function of the CRVS systems. In this complicated and strenuous context, the royal government of Cambodia has strived to build social resilience by focusing on health system development, promoting quality and greater scope of public health and social protection services, as well as human resource development. The royal government of Cambodia has rolled out vaccination as a key strategic measure to prevent the community transmission and to strengthen treatment capacity in combination with other social and economic intervention strategies aiming at stabilizing businesses and livelihoods of its people. The CVRs, both mature and immature, has continued to function based on practical situation of the regions. The aforementioned strategies and measures have significantly contributed to creating favorable environments for the sustainable registration of vital events for the most marginalized and vulnerable populations in particular. This is how Cambodia responds to the challenges posed by the COVID-19 pandemic in contribution to the expeditious recovery of the CRVS systems and their continued functioning. Thank you.
Thank you so much for your comments, and thank you so much for starting off this panel as well. I'm going to now turn to His Honourable Cabinet Secretary Islam from Bangladesh.
Okay. The moderator, Honorable Ministers, Excellencies, ladies and gentlemen, Assalamu alaikum. It's my great pleasure to be virtually present in this meeting. On behalf of Bangladesh, I would like to thank ESCAP and other organizations for giving us this opportunity. Excellencies, ladies and gentlemen, as one of the most densely populated countries in the world, we require very efficient civil registration system in order to get everyone in picture. Under the leadership of Her Excellency Prime Minister Sheikh Hasina, Bangladesh has a very high-level political commitment for strengthening the CRVS. The local government institutions are actively engaged in birth and death registration all over the country, and marriage registration department has been assigned to go for the registration of the marriage since 1961 under legal provisions. One of the important efforts of our whole nation is the social safety net program, which amounts to be 18% of the national budget and 3.11 of the GDP. To ensure the maximization of resource utilization and cover maximum beneficiaries, CRVS system is an imperative step. Further to note is that our all stipends and benefits given to millions of incumbents are based on CRVS. During the pandemic, we actually felt the need of the CRVS. As our Prime Minister Sheikh Hasina delivered 31-point multi-dimensional program, guideline and incentives in order to combat COVID-19 challenges. Almost in all those initiatives and programs, CRVS played a vital role in the form of use of national ID, introducing national unique ID, online birth and death registration and the certificate, and rapid mortality and surveillance and cause of death finding. By using these CRVS tools, we are successful in drawing effective programs and benefiting millions of people. One of the important was the developing the COVID map of the whole country, which clearly revealed the area of effect, severity, and the future projection of the COVID situation. It led us, health workers and social workers, to come forward with prior programs, for which we think was one of the important reasons that our devastation was comparatively less. Number two was the massive financial package which was declared by the Prime Minister. Millions of people were assisted and relief were distributed by using national ID, birth certificate. they had their transaction account by using those NIDs and birth certificates. So nobody could be out of the account in that program. And in another was that the massive vaccination programs which were carried out and still being carried out are based on absolutely on NID and birth certificate. So we can easily count each and everybody who is are being vaccinated. CRVS also played an important instrument in actually determining the severity of the COVID effect when we found that the unusual rise of the death count were taking place in some place, and we actually compared to the original statistics. So our doctors and clinical persons intervened there and actually took proper action. So CRVS system, but still we need some strengthening of this, no question about it. Since the first ministerial conference, every member state certainly has some success, which we can call to be the first CRVS decade. And now it is the second one, and we must address all challenges by working together with the government and development partners. International and regional support and collaboration will play a significant role to establish a more resilient CRVS system. So in this regard, we have got some very precise recommendations, such as interlink the civil registration and identity management system by ensuring the legal framework, assess the inequalities of CRVS and identify the marginalized and vulnerable groups in order to include them. Then it is necessary to establish a feedback procedure to overcome the barriers of the system and set up a hotline calling system to address the people's need. And then it is required to ensure that business processes are simplified and made workable so that they can be effective both in normal and crisis situation. And then develop community awareness of the registration process and benefit of the registration to create demand on the citizen side. We have taken this to be a very important tool. In fact, promote more electronic and other media to highlight the necessity of birth and death registration and other CRVS tools in order to create awareness among all. And another one is the government must have a whole of government coordination mechanism. I mean, integrated approach among all the departments of the government. Last but not the least, of course, mutual exchange of the best practices, learning and experiences of the member states will certainly help all to redesign the resilient CRVS system. So with this, I would like to conclude. Thank you all.
Thank you very much. That was very comprehensive and very interesting. I'm going to now turn to the Honourable Minister from Laos to give us his responses to this question.
Thank you very much. Thank you very much, our honourable moderators and excellencies, esteemed panelists, ladies and gentlemen. The government of Laos PDR, or in the context of Laos PDR at the moment, as you are aware that we are part of the global communities that are being adversely affected by the COVID-19. We first suffered heavily around mid-May 2021. We still have a high numbers of the COVID-19 transmission at the community level. Right now, we have about 700,000 of people infected with COVID-19. At the moment, about 10,600 being treated. 116 have already been the casualties of the COVID-19, and still hundreds more that being quarantined. Ladies and gentlemen, the COVID-19 pandemic, needless to say, that has posed significant impacts to the way of lives of the people, has disrupted the service deliveries of the government, including the civil legislation. The civil legislation during this time, I think like any other economies, that we would expect lower rate of legislation. Yes, we have already put in a number of efforts in order to prevent the COVID-19 pandemic, in particular to increase the coverage of the vaccination. Hopefully that by the end of 2021, we'll be able to hit the 50% target of the population for the vaccination coverage. We're also working hard in order to reintroduce the new normal. Yet, but we cannot compromise the health of our people. A lot of people are still hesitant to register their vital events given the ongoing pandemic. Even though that our registrar offices all around the countries are still serving the public on a regular basis, but we see the drop of the registration. As for the debt registration, the cost of debt registration and the certificates of the debt registration during this time of crisis is even very important. And this is the very important job of our District Office of Home Affairs to register all the debt events so that we can identify whether such debts related to the COVID-19 or not, and in order to make sure that we can reintroduce the way of life as it used to be. Thank you very much.
Thank you so much. Thank you so much, Minister. Do we have the Honourable Minister Sao of Samoa with us, and could I invite his comments?
Thank you. First, I wish to express our sincere gratitude for the messages of sympathy and the kind sentiments shared on the untimely passing of our dear colleague and government statistician, Arimomoa Malaifono Tawa Fasalaina. She has been a stalwart leader for our Bureau and a hard-working public servant that has for more than 30 years contributed to providing relevant quality statistics to support informed decisions to better the lives of the people of Samoa and the region. In terms of the topic discussed, Samoa still remains a COVID-free nation. Hence, it has faced minimal impact to its civil registration system. As well, everyone has equal access to civil registration systems. It was during the early days of the pandemic that some interventions such as lockdowns were imposed, that there was limited access to the civil registration systems. However, a first-time nationwide mass registration campaign was conducted to capture all the unregistered events. The use of technology to connect virtually around the world during these challenging times provides an opportunity for the civil registration system to grow and adapt to ensure such services are available at all times. It is important to ensure civil registration authorities maintain operational continuity during COVID-19 and allow for continued production of comprehensive vital statistics. In summary, some of the issues that we are looking at to strengthen this is our commitment to enhance infrastructure, IT within our country, so that to improve access to connectivity on that basis. Thank you.
Thank you so much. It's incredible that Samoa remains COVID-free, and I hope that may last as long as possible. And finally, I'm going to move to the Honourable Deputy Minister from the Maldives.
Thank you for the opportunity, Ms. Collicott. I'm Secretary General of the United Nations and Executive Secretary of ESCAP, fellow ministers of the Roundtable. Assalamu alaikum. Maldives was first hit with COVID-19 in April 2020. During this time, we faced numerous challenges and disruptions in the delivery of vital services to the public. This includes the disruption of issuance of national identity cards, which is the unique identifier for accessing a lot of our services across the country, such as the use of healthcare, national health insurance scheme, travel, and banking. As an immediate action to curtail any difficulties faced by the public, senior policymakers of the Maldivian government made the decision to impose a moratorium on issuing identity cards. This allowed the temporary use of any outdated national ID cards and other forms of identification such as driving licenses and passports that can be linked back to the national unique identifier for accessing any services given to the public. Apart from this, several digital applications were developed to provide services related to COVID-19, including sampling, quarantining, isolation, vaccinations, and contact tracing. All these applications utilized the national ID number to track everyone and enabled communication between systems and reduced data duplication, leading to a streamlined provision of services. Additionally, His Excellency President Ibrahim Mohamed Solih made an executive decision and commitment to providing equitable care and vaccinations to all residents of the Maldives, including the expatriate population. It is our mandate at Ministry of Health to ensure that we leave no one behind when providing vital services. One of such marginalized groups that we have in our community are the undocumented migrants. The COVID-19 response highlighted the importance of establishing a mechanism to uniquely identify such undocumented migrants so that we can eliminate the barriers that they face on a regular basis when accessing services. We addressed this by collaborating with stakeholders to reach out to such migrants and developed a registry which assigned a unique identifier to access all services. A lot of our non-government institutions helped us on this endeavor, and we are entirely grateful to all the support that we received from everyone, from all relevant stakeholders in the Maldives. Thank you.
Thank you so very much. That is very interesting to hear about the unique ID cards and the challenges you face there as well. I'm going to move on to our next question, which is actually building on what we've already heard of some of the successes, but it's about looking at the future, really. How can governments and development partners comprehensively make the CRVS systems in the countries more robust for future crises and shocks? So what have we learned from the measures that have been put in place as a result of the pandemic, and how can these systems be made more robust for the future? And I'm going to come back to our first speaker now, Somdet Karalhom of Cambodia. Over to you.
Thank you very much once again. Excellency Amida Sasia Alijabana, Under Secretary General of the United Nations and Executive Secretary of UN ESCAP. Good afternoon, Excellency, ladies and gentlemen. For guidance on the restructuring and strengthening of more mature CRVS system and on quick recovery from the crisis and emergency situation, as well as on adaptation to new situations, Cambodia is currently implementing a number of initiatives as laid out in the 10-year National Strategic Plan on identification from 2017 to 2026 in an objective to provide assistance and also support on civil registration and vital statistics system. Cambodia is investing in computerizing civil registration by applying web and mobile technologies. Mobile technology will facilitate the civil registration of vital events in areas that are remote and otherwise isolated, and will support regular mobile registration days in all communes and villages. In the short-term period, Cambodia is piloting and rolling out commune-based one-window services where people can come to register vital events and apply for ID cards. In the long run, Cambodia aims to have civil registration and residence registration available online. This will help to ensure easy access to registration services and faster and more efficient registration, bringing services closer to the people and eventually allowing for registration online will help prevent the disruption of services during future crisis and emergency situations. Timely and comprehensive vital statistics produced from the register will assist the government in setting effective objectives and responses to the crisis and shocks. The aforementioned initiatives in Cambodia cannot exclude the engagement of development partners through technical support, resources, and the sharing of international best practices. Thank you.
Thank you so much. It's good to hear about how mobile technologies have been used to reach some of the most marginalised communities there. I'm going to ask the Honourable Cabinet Secretary from Bangladesh to address the question.
So thank you very much. Actually, one of the important concepts we have got in this pandemic, that is called God's Act. Personally, I'm very much oriented with this concept because I was implementing a very iconic project in our country, which is called Padma project, and it has been defined by the international experts to be one of the most complex structure ever to be built on Earth. So we found every now and then that after having very precise and well-documented design and estimate, every now and then we started facing trouble and trouble and trouble, because Padma is such a river which cannot be actually brought under any kind of discipline. So every now and then we had destruction, we had to go for new design, new plan, new program. So I was also involved in some other mega project implementation. So I have this concept, but the country and the nation has learned that there is an event called God's Act. The whole world got it in 1928 and 29 when the world experienced the Great Depression. But I think after that, nobody experienced this much. So this actually pandemic has led us to learn it that yes, all our plan, program, and budget will be there. But at the same time, we have learned that we must have our flexibility and some reserves so that we can combat with those scenario. But in that case, CRVS, all statistics are very much important. Otherwise, it is simply not possible. And I thank ESCAP and other organizations who actually initiated this movement to go for the CRVS. We were very much involved with CRVS, but the concept of CRVS was not on the table or on the field. So it did not create that much of impact. But now everybody is on toes in our country, particularly I would say that the need of the vital statistics is absolutely imperative. So I think these have actually in totality has given us a new field and new arena to work upon. Thank you.
Thank you so much. It's wonderful to hear. And then the Honourable Minister from Lao PDR.
Thank you very much for another opportunity. Madam Moderator, esteemed panelists, ladies and gentlemen, in order to prevent the future losses and casualties, I think it's very important for the development partners and the governments of economies in this region to further strengthen our CRVS systems, to make sure that we put in place the early warning system, especially at the grassroots level, in particular, the cause of death registration, the certifications of death, and simplify the business process in order to enable the easier access for the public for the key legislation, in particular the debt legislation. I think that would be very vital. And we also look at the opportunities of making use of the digital technologies without the physical presence at the office of registrar. Thank you very much.
Thank you very much for those comments. I'm going to turn to the Honourable Minister of Samoa.
Thank you, Moderator. Samoa was the first Pacific Island country to use the Business Process Improvement Framework introduced by UN ESCAP. The Statistics Bureau worked together with national stakeholders to review and assess the CRVS system. Samoa has completed the first stage of the framework, which reviewed and analyzed the CRVS system and highlighted a proposed redesign of the system to be more robust for daily operations and future crises. Some of the support mechanisms that we are still looking at so that it links with this are the literacy and the capacity of the people that are involved, so that they are able to establish linkages and connection with the relevant service providers that are providing the vital statistics to the country. Thank you.
Thank you so much. Thank you so much for also bringing a non-technical perspective in around the human capacity and skills as well. So it's useful for us to hear the other side of the dimensions. And then finally, I'm going to turn to the Honourable Deputy Minister from the Maldives, please.
Thank you for the opportunity once again. Our experience with the COVID-19 pandemic showed that decentralized, digital and integrated systems is the future, in contrast to manual and silo systems in providing undisrupted services during emergencies. For a country such as Maldives, which is made up of hundreds of inhabited islands, which are geographically isolated, we needed a solution to combat the new emerging health issues faced by the pandemic. And I would like to highlight the technological capabilities of Maldivians across age groups in the Maldives. Many Maldivians are technologically savvy, very tech literate. We leveraged on the high digital literacy and usage of internet services across the country to enable digital innovations to provide essential services such as teleconsultations. This proved to be the ultimate solution to combat the potential catastrophic consequences of travel restrictions and lockdowns. Based on these lessons learned as a way forward with post-recovery from COVID-19 and to mitigate future crises and shocks, we have flagged digitalization of the health sector, including a decentralized and integrated CRVS system as a national priority in the National Resilience and Recovery Plan. As of now, we have initiated decentralization and integration of the CRVS across all the inhabited islands. Thank you.
Thank you so much. It's an absolute amazing way to actually meet that challenge, and hearing about the teleconsultations is fascinating. I wish we had a little bit more time to go into a bit more detail about them, but it does sound absolutely fascinating on how you're connecting across the islands. I'm going to move on to my final question before we go to closing remarks. And my final question is around the COVID pandemic, as we all know, has demonstrated that while performing CRVS systems in normal times are already difficult, but in crisis, this is heightened even more. And so we've already started to touch on some of the key considerations in the guide for the redesign of some of the systems. So both for mature, but also for immature systems as they move towards resilience. And I've heard a little bit already about some of the key changes you're making, such as the Minister from the Maldives highlighting the importance of decentralizing and integrating systems at all levels. I would be keen to hear from the other countries a little bit more about some of those redesigns that you are making to your CRVS systems so as they move towards the future. Could I first of all turn back to the Somdet Karalhom of Cambodia again, please?
Thank you very much for allowing me to answer question number 3. Ladies and gentlemen, in order to allow resilient CRVS, both mature and immature, to function in crisis and emergency situations, I would like to provide a few concepts as follows. We need to reinvigorate the notification of vital events through physical and electronic means from health facilities to competent civil registrars on vital events and that occur in health facilities and from competent village chiefs that occur outside health facilities to enable registrar to record and registration preliminary. On this particular point, I would like to inform Excellency, ladies and gentlemen, that generally we can say that the vital events have occurred within the health facility, and as I said, there is minimal occurrence outside of health facilities in Cambodia. Number 2, a grace period for, let me start again. Such notification is required to ensure that a civil register have enough information for verification and registration when the situation returns to normal. Number 2, a grace period for civil registrations should be granted. For example, Cambodia allows 30 days for birth registration and 15 days for death registration. However, our new draft law grants a grace period that is it is within our considerations to give a period of 1 year for birth and death registration. Therefore, in the event that there is an interruption in services during a crisis, people will not be penalized for late or delay registration. We are now considering this option. Number 3, in light of the notification and information received from health facilities or competent village chiefs, civil registrars shall remind citizens to come and register. If necessary, civil registrars shall move around in their respective jurisdictions to process civil registration for those who haven't registered. Cambodia is successful in this work. And I would like to inform that this is the effective response, in the crisis situation. Number 4, in addition to the designated places for registration, we should establish more registration locations according to the practical needs and situation. For example, the locations where there are increasing vital events at refugee or makeshift camps in case of natural disasters. And number 5, it is necessary to revise and review some complicated procedures. Example, even if the informant lack of attached documents and minimum information, the civil registrar shall register the birth and death according to the information they have received. And at the same time, the civil registrar shall give the information certain periods, shall give the informant certain periods, so that the informant can provide further information. I thank you very much.
Thank you very much for outlining those very clear measures that you're taking to adjust the system in response to what you've learned there. I'm now going to pass over to the Honourable Cabinet Secretary from Bangladesh.
Thank you very much. This is the 39th year of my service in the government, and I never felt the importance of statistics so much, which I actually experienced during the pandemic. So I must say that this actually pandemic brought up a tremendous cooperation in the mind of the government officials as well as the politicians and the general people. So everybody came forward to give maximum service or render maximum service to the development of the nation. This was a unique sight in the whole pandemic. And of course, we have got success. We have got a lot of innovations during the pandemic. But at the same time, we also had the sufferings, no question about it. So we have learned that it is not only all good things, but at the same time, we also have some odd things. So we also had international cooperation with the cooperation and came forward how to give our success to them whenever we are asked about it, how we could contain our COVID situation in a tolerable scenario, although this is a massively populous country. And at the same time, we also expressed our sufferings to them, and we got the prescription from them. So the share of the experience with local and international community was a key factor in our comparatively less devastation. And another thing was that throughout our life, it took a long effort to motivate people, but this time it was so easier. Everybody came forward and took it, whatever, what good things were actually expressed to them. And another important thing was that more and more financial and administrative authorities were actually delegated to the grassroots level. So they could take a lot of strong and important decision, and also were able to spend whatever they needed. That was absolutely a very fundamental one in combating the pandemic. And for that, the vital statistics, again I come back, was a fundamental, because nobody actually gave any concession to that one. And our IT sector has become much more effective and much more people's oriented and much more beneficiary to the all sectors of the country. And huge program, I mentioned you all huge financial program, package program, which was declared by our Honorable Prime Minister, actually was the backbone to actually face this kind of terrible disaster, particularly production, employment, export, livelihood. And this huge package program was totally based on the CRVS and national ID system. So I must recognize and confess this was a fundamental one. But at the same time, I go back to my another important aspect, that we must have mutual exchange of best practices, learning experiences of the member states to redesign our resilient CRVS system. Thank you.
Great, thank you so much. The common theme of actually deprioritizing, going down to the local level, is really coming out in our discussion today. So thank you so much for those comments. And now to the Honourable Minister of Lao PDR, please.
I would like to extend my sincere thanks. First of all, I would like to pay my respect to the moderator, distinguished participants, ladies and gentlemen. To ensure that CRVS system is stable and resilient, the Lao PDR need to modernize our system into electronic system and use innovation and information communication technology and new technology, especially for the civil registration and vital statistics in an electronic manner, and the notification of vital events in electronic manner, registration and certification in online process, and move toward using innovation and into providing services using electronic tools, into finding the causes of death, as well as using ID code for the cause of death. Thank you.
Thank you so much. Digitalisation, technology, innovation is obviously very critical as we move forward around CRVS and how communities engage with CRVS. So that's very good to hear. And then I'm going to move to the Minister, Honourable Minister of Samoa, please.
Thank you. We seem to offer similar ideas on this question, and Samoa is likewise the same. Although our first point is on the legal framework, and there seems to be a need to review the legal framework to be more resilient, to take into consideration the proposed changes to the system. The other one is that the decentralization that our other colleagues have mentioned. We're also looking at assessing decentralization of the services, the use of the existing mechanisms and government initiatives through district council office to decentralize registration services for ease of access. We are also looking at incentivizing the system, providing incentives for registration to ensure events are registered within the required time frame. So it's like instead of someone paying, we are looking at paying for a newborn, so that then that's an incentive for people to come and register if they know that they are getting some sort of funds from there. Then the last one is the digital solution, digitization of records for safekeeping and having secured backups as contingency, streamlining CRVS process and the use of technology to do online registration. I would like to also emphasize, as I had previously mentioned, the need to enhance literacy and the capacity of the people so that they are able to absorb. And also the encouraging of the use of technology, not only for this one, but for other uses, so that they are attracted to it, so that they are able to use technology as another form of economic opportunities for them. With that, thank you very much.
Thank you very much. That's very comprehensive. And then finally, to the Honourable Deputy Minister of the Maldives, please.
Thank you for the opportunity once more, Madam Moderator. We were actually in the process of rolling out a new digital CRVS system in the Maldives when we were hit with our first wave of the COVID-19 pandemic. As our Minister of Health, His Excellency Ahmed Nassim highlighted in his remarks during the ministerial segment, and as I mentioned before, many of our essential services are very much reliant on the CRVS system, such as the use of the national identity cards. The COVID-19 pandemic demonstrated the urgency and acted as a catalyst for us to prioritize and speed up the decentralization and rolling out of birth and death module of the online CRVS system to all the inhabited islands of the Maldives. And I must note, as our Director of Health Information Research Division noted in her statement yesterday, all of our birth and death records are standardized as per international standards. The online system locks in the standardization and ensures data is collected in the same format so that all vital statistics and depth coding is shared across the borders, and birth and death, we are able to monitor international and national indicators to including the global goals and sustainable development goals and the national and international priorities that the government of Maldives ensures. It also forced many of our government and private institutions to provide their services on digital platforms. We have the technology, however, the circumstances forced upon us by COVID-19 pushed us to become more creative and efficient in service provision. During the redesign of the CRVS system, we learned that it is important for all our stakeholders, our relevant stakeholders, to work together, keep the dialogue open across institutional borders, and take ownership of the system and harmonize the development of the system with respect to their needs. For a country-wide system, standardization, architecture, and interoperability issues need to be addressed simultaneously. For an evolving system, it should be integrated yet decentralized so that it can unify all systems, all information holistically. Based on our experience, such a system is the best solution to be utilized in crises and emergencies for geographically dispersed islands such as the ones in the Maldives. Thank you.
Thank you. You've touched on some of the critical elements of a strong, robust CRVS system of integration, standardization, interoperable systems that can respond at pace and in real time when a crisis hits. So that's fantastic. And it seems like a lot of work has been underway in the Maldives in light of the pandemic, but also it already started pre-pandemic as well. So thank you for that. I'm very much aware that our time is pressing upon us very, very quickly. And although we would have liked to have a little bit more of a panel discussion, we're going to have to move to closing statements from the various different ministers of each country. We don't have a huge amount of time, so I would like to just suggest that if you can highlight the key facts that are the most important in your closing remarks, that would be greatly appreciated. We've had so much.
I would like to share with you is that we require to register the vital events successfully, because it is connecting to the future of each and everyone, and also each family. This is very crucial. And secondly, in order to ensure the successful registration of the vital events, we have a lot of work to carry out. And what is important, we need to have the legal framework, specific legal framework, and we need to have the precise national strategic plans. We should also have, the national framework and subnational framework. Cambodia is implementing the D&D reforms, that is the decentralization and the concentration. We are working very actively, including the work of the civil registration and registration of vital events. Thank you very much.
Thank you very much. Moving on to the Cabinet Secretary of Bangladesh.
So thank you very much. Actually, what we found that some of the things are very much needed. Actually, political commitment, good leadership, and also a very precise statistics. Otherwise, it is not possible to handle this kind of disaster scenario. And what we experience that as Homo sapien, we have one of the important characteristics is the adaptation, and we found it to be really true. And it became true because we could give massive package program to the general people, and that was possible only we have the statistics. So we have to make it much more realistic and usable. Thank you.
Thank you very much. It's wonderful. Moving on to the Honourable Minister of Lao PDR, please.
I would like to extend my sincere thanks. It is of my honor to hear the remarks from the ministers and the summaries from the ministers on the important matters in this discussion for this afternoon. As for Lao PDR, the first important matter, we will continue to strengthen and improve the legal framework and the relevant legislation to use as a reference to see for review registration and vital statistics system. Secondly, we will continue, and currently we under the process of implementing the application of information technology and modern technology into CRVS system. But most importantly, the third important matter, I would like to reiterate this matter. Even though we have modernized system, but our population are not aware or do not have an understanding or do not prioritize the cyberization. If that's the case, we will not be able to achieve our target. Therefore, Laopedia prioritize the sharing of information and raising awareness of CRVS so that all Lao population and citizens are aware and have a sound understanding and take ownership to actively contribute into CRVS or civil registration system. Thank you very much.
Thank you very much. Moving on to the Honourable Minister from Samoa, please.
Thank you, moderator. Despite the short time that we have shared, it has been quite a learning experience for me and for our small country in the Pacific. And although we are COVID-free, we should still be attentive to the impact, especially to our people. Samoa commits to our collective vision for universal and responsive civil registration and vital statistic systems that facilitate the realization of rights and support good governance, health, and sustainable development. We encourage enhanced cooperation among our member states so we can advance efforts for the implementation of the 2030 agenda to ensure no one is left behind. And for that, we thank you very much.
Thank you very much. And then the Honourable Deputy Minister from the Maldives.
Thank you, Madam Moderator. I would like to conclude by stating that Maldives places a lot of importance on digitalization and ensuring our health systems talk to each other to make systems more efficient. Our team at Health Ministry has a rich bank of health information, and did not let the pandemic stop us from publishing statistical information through Maldives health statistics publications and the Maldivian health profiles, because we place a very huge importance on sharing information with the public on an annual basis. Maldives has also pushed forward with the National Statistics Bill and the National Birth and Death Registration Bill amendment, which is currently in the Parliament and is currently in the process of developing our health information bill. So we place a lot of importance on vital statistics and civil registration. To conclude, I would like to say that we could not have proceeded forward without the support from our partner agencies in developing our civil registration and vital statistics system, and it is crucial that this support continues as small and developing states such as us require further assistance in streamlining our systems. I look forward to working with all of our agencies, with all of our partners and countries in pushing forward and working towards a shared vision in establishing proper and streamlined civil registration systems. Thank you.
Thank you, Honourable Deputy Minister. It's a great way to end the conference in actually talking about the important role that collaboration, partnerships, the shared vision needs to play in how we take CRVS systems forward in the Asia-Pacific. That is going to be essential to all success. We've heard a lot about the importance of legal frameworks, the importance of technology, the decentralization of services so that they are closer to those people who need to be registering their events on a regular basis, and the importance of integration of systems across government as well, so that information is being shared, but there is also clear skills, capacities and data literacy to be able to interpret and use the information that is coming out for decision making, so that the linking back to administration of social protection schemes, moving quickly towards vaccination programs, all underlies the importance of a strong, robust civil registration system. It's been an absolute honour to moderate this panel, for me this early morning, but for you all in the afternoon. We have heard of so many interesting challenges that you have faced and have overcome and are overcoming as you move forward as well. Esteemed panelists, colleagues and friends, this concludes our Ministerial Roundtable discussion today. It has been a pleasure to speak with you all today, and I hope that our attendees have taken some valuable information away from this panel this afternoon. A big thank you for your time, and I hope you go on to enjoy this conference and it is a successful, productive and energizing conference for us all. Thank you so much and good afternoon.